Hello there, everyone. Welcome back to Midwife Par Excellence. I am your registered midwife, Bernard. Today, I will be talking about a topic that has been well requested, and so I decided to put together a little list. And what I will do, I will go through with a fine tooth comb as to the items on this list and explain. All right, so today we'll be talking about what should be in your shopping list, what should go to the hospital with you for both mother and baby. All right, and some items and additional items that I think is very important that every mother or every household with a baby should have in it. All right, so let's go. All right, first on my list, you need to remember that the ultrasound is not always 100% correct. So therefore, ladies, gentlemen, in your shopping, you want to shop unisex colors. All right, so your red, your white, your blue, your green, your purple. I see nice black colors coming out. Um, White, nice colors. All right. So if the ultrasound says it's a girl, I don't want you to go and shop all pink. All right. There are instances where I have dressed quite a few boys in pink because that is all the mother brought because that's what the ultrasound said she's going to be having a girl. All right, so I encourage you to shop unisex colors. All right, so whatever the sex of the baby that comes, all is well. All right. Secondly, you need to remember that you're shopping for the baby at many ages. All right, so I wouldn't encourage you to go out and buy all newborn or 0 to 3 months. You want to mix it up. So you want to shop as at the age 24 months, 2 years old. All right? You want to shop wisely. So let's say you do a big shopping. You don't have to be looking to do another shopping again when the baby gets to 6 months old or 1 year old. You would have had enough clothes in many different sizes that is able to suffice until at least 2 years of age. All right. Now, on my list here, and this was a well thought of list based on experience, all right, personal and work experience. All right, so first for the mom, we want to have an open front nighties, low cut nighties. And of course, it speaks for itself. You want your open front or your low cut nighties so you're able to breastfeed. All right, because of course, all my mommies, we plan to breastfeed our babies. And imagine you have on a clothing that is all the way up to here. You're gonna have to now be pulling yourself up and cutting your clothing unnecessarily when you could have had your button front. You have the button front nighties and you also have those low cut nighties that make breastfeeding a little easier for you. All right, on my list I have panties. Now ladies, I encourage you to get comfortable panties. All right, those little V cuts and strings that we often walk with, if it's not going to make you comfortable, do not wear it. Ladies, remember, after you've had your baby, there's going to be some amount of bleeding, and you want to have on underwears that will hold the pads that you're going to be wearing comfortably. All right, limiting the amount of spillage possibly that can occur. All right, also, I mean, you want underwears that are gonna come all the way up to above your navel. All right, all right. So making you comfortable and feeling a little bit better about yourself afterwards, especially if you have done a surgery. All right. Next on my list we have slips. Now, ladies, I think this is very important. You can either get slips or you wear tights. All right, but I think it is not appropriate for you to be walking on the ward in a ward setting and your underwear is showing through your nightgown. All right, remember from time to time we have visitors on the ward, males, females, people of different areas. All right, so you want to be in a kept place. All right, so you wear your slips or your tights so your underwears are not showing to the public so much. All right, if any at all. Now, brassiere. Ladies, remember, in your shopping, remember that your breasts are going to grow a little bit bigger than you would normally have them. So it is important that you at least shop for two sizes up. All right? Do not shop for the bra that you know you would normally wear before you got pregnant or what you're wearing now. After you've had your baby, your breast is expected to enlarge. All right? So you want to get at least two sizes up so you can if accommodate when the breasts are filled with milk. All right? Yes. Maternity pads or napkins. Now, this is very controversial because persons, I've seen them come with the regular size pads. Now, ladies, after you've had your baby, a regular size pad is not going to help you. All right? There will be some amount of bleeding, and you want to have on a pad that can, you know, efficiently secure you so you do not get messed up very easily. All right. We have maternity pads. Different companies have come about with maternity pads over the years. There is one that I know that persons are coming in with now, and that's the Always Extra. All right, extra overnight hold, and it is this one here. Let me put it up so you can see it. It's this one here, and it can hold. Let me open also. It's very thick, right? It's thick and it's very long, and that is what you want. You want something that is gonna give you coverage, all right, to hold the amount of bleeding that you will be having for the first few days. All right, so you want to secure yourself. Now, next on my list we have our basic amenities, or soap or toothbrush, toothpaste or towels or rags, deodorant, comb, brush, and or lotion. All right, so those are a given in your bag, ladies. Those are a giving. All right, next we have Dettol or Savlon. And of course, we all know Dettol and Savlon, and this is to help you when you're doing your tidying or you're showering. You want to have your little antiseptic there with you, all right, after you've delivered your baby and even before. Slippers. Now, I encourage you to walk with 2 pairs of slippers. Purses normally come with the little fluffy ones. Those are what we call the bed slippers. All right, so you can take that with you, but I'm also requesting that you take rubber slippers with you for showering purposes. All right, when you go to the bathroom to take your shower, you are not going to be able to bring your bed slippers into the shower because, of course, it's going to be wet. All right, so you want to change into your rubber slippers for showering purposes. When you get back to your room or your bedside, then you can switch over into your bed slippers. All right. Incontinent pads. Now, this has been an item that is being requested. It is often provided by the hospitals. However, it is good that you have it with you, right, for laboring processes or even after you've had your baby. So incontinent pad, persons are always asking me what really is an incontinent pad. So I have sought one, and it can be found at the corner shops, in the pharmacies. Many places are selling them now, so it's not so hard to get as before. And this is really what an incontinent pad is. It is a piece of plastic, all right, and inside of it, it has cotton, a type of cotton type of material, all right, and this is what it is. Let me take my time and go slowly across, all right, and this is what it looks like on the external. So it's plasticky on the external. It comes in different colors. I think I see a beige one, I see white, all right, and this is what it looks like, all right. So when you go to the shops, you know definitely what you are looking for. And what this really is to protect the bed linen, all right? So when you are in your labor process, remember there are a certain amount of secretions that will be happening. You want to protect your bed linen, all right? Also, after you've had your baby, it's very important that you have these also to protect your bed linen, even in the hospital and even after you've gone home. So you want to protect your sheet, so you just have this, spread it out, and you lie on it, all right? Yes. Next on the list, we have antenatal book. Now, ladies, This is very important. This is like your passport when you go to travel. You appear on the delivery unit. The first thing they're going to ask you is, what is happening? Secondly, they're going to be asking you for your antenatal or your clinic book. All right? This is where all your history about your pregnancy is. All right? And it's very important that you produce this document so we can actually know what is going on with you. All right? Without this document, we don't know anything at all. We'll just have to be going word of mouth with what you said, and that's not really good enough. All right? So your antenatal book must always be with you. All right, at all times. Even if your delivery bag is not going with you, your little handbag that you have, your antenatal book must be in that bag. All right. Now, also, remember we had said before, the ultrasound is not always 100% correct. So therefore, my next point you will understand. Please go with a girl name and a boy name. Yes, I know the ultrasound told me it's gonna be a girl, and you know, I've had mothers who have come in before to have one baby and twins came. I've had mother who came in to have twins and triplet came. So guess what? I'm requesting 2 girl names and 2 boys names just in case. All right? Yes. You also, for registration of the baby purposes, you need your ID, your tax registration number, your birth certificate. If you are a married woman, your husband will not need to take these documents. All you need to do is walk with your marriage certificate and you can cover for both of you. All right? So bear in mind, listen again, your ID, your TRN, your birth certificate, $200. All right. However, if you are married, your partner will not need to produce these documents. You can do it on behalf. You just need to take along with you your marriage certificate. All right. Now, we're moving on to what is needed for the baby. Yes. All right. So our olive oil, and of course, it is used to bathe the baby at birth. All right. Different institution does their thing differently, but it is what it is used for at birth, to bathe the baby. All right. Shirts and pinondas. All right. So we have some little pretty baby clothing. Yes, and I know we all love to go baby shopping. It's something that we all look forward to. So we have our little shirts. Now we call them shimmies. All right. This is a pinonda. So this is what a pinonda looks like. All right. And you want to stock up on a lot of these. And I always say, because after you've had your baby, the umbilical area will still be clamped to protect it for any flying insects or any external things. You want to keep a baby in your pinonda. All right, I think this is favorable for a baby at birth. All right. Next, we move on to socks, hats, receivers, and blankets. Now, there's a slight difference. So the receiver is the little smaller ones. The little thin ones, yes, these are receivers. And then the blankets are the big, thick, woolly ones. All right, these thick ones that, yes, keeps them so warm and cozy. All right, so there's a slight difference. So we have receivers and we have blankets. Rags, of course. White alcohol, and you notice I specify white alcohol. All right, and this is to clean the umbilical cord after delivery. All right. Cotton swabs. So your cotton swabs go with your alcohol for cleaning the baby's navel. All right. Pampers, nappies. Now, I specify pampers and nappies because some persons will not use pampers. All right. They choose their nappies. You can get your nappies made, you can buy them in the store, or you can order them online. All right, so not all mothers use pampers, for their babies. Some persons use nappies all the way. All right, and of course your wipes, for those who use wipes. Again, I say you have persons who have chosen not to use wipes, but in the event that you choose to use wipes, remember it on your list. All right. Now, that was it for mommy and baby's bag for the hospital and shopping. Now, there are some items that I throw in there. All right. So we have our Desitin and our A&D ointment, and this is just in case the baby gets chafed. All right, ladies, remember, baby must be checked and changed when necessary. All right. When you do that, it prevents chafing from happening. Check the pampers at all times. Ensure the baby is dry at all times. All right. So we all know what the Desitin looks like, and this is one of the color of the A&D ointment. All right. So you have the Desitin and you have the A&D. This is the brown color. All right. It says diaper rash, ointment, and skin protectant. All right. And this is just one of the many colors that they have. I think there's a lavender purplish looking color, and this is the brown one. All right, works very well. Works very well. All right, we also want to have our petroleum jelly. Now, let me tell you, ladies, this is gonna be your best friend. All right. I've had reports where persons say the petroleum jelly doesn't work for their babies. I don't know what happened on that side, but trust me, it works wonders. When I tell you, your baby will not be chafing, your baby will not be chafing if you follow my lead on this one. Now, for the petroleum jelly, you have different brands on the market. This is just one of the many brands. All right, so this one, you have them in blue, you have them in pink, and you have it in green, I believe, and there is also the natural one with no scented. All right. Now, when you change your baby, you're gonna put it a little bit in the groin area and between the butt cheek. I guarantee you, if you do this at all change, you will not have a chafing issue. I guarantee you. You can also give me the results when necessary. All right. I guarantee you, this is gonna be your best friend, mommies. Okay. Yes, reach out to me for those persons who have a testimony, and for those persons that have encouraged and have taught how to use this thing and it has worked for you. It is working wonders for the mothers. It did for me. I've never had chafing issues with my children, and this is all I've used. My other products, skin protectants, are on the side just in case the baby becomes chafe. This is what you use. All right. As I said, this is just one of the many brands of petroleum jelly. I'm just showing you so you at least have an idea of what I mean when I say petroleum jelly. All right. So this is what you want to have right there on the side of your bed or side of the table where the pampers or the nappies are. Okay. Mommies and daddies, yes. Now, Panadol pain and fever for baby. It is very important that wherever there is a baby, there must always be Panadol or Cetamol pain and fever in that house. All right? Now, this is what it looks like. This is the Panadol. Panadol. And this is for baby. All right. It comes with a dropper. Ensure you get the one that comes with dropper, so it makes administration to the baby a little bit better and easier for you. All right. So this is for the babies. Panadol pain and fever. Relief of pain and fever for the baby. All right. And then for the bigger children, we have the Cetamol. Cetamol pain and fever. And this is for the bigger children. So the babies, newborns, this one. And then for the bigger children, this one I believe is from 2 years and up. Yes. All right. So babies, pain and fever, children. Some persons have bought this one. Nothing is wrong. It's just that you will have to now determine how much you give to the baby. But with this one, it comes specifically from newborn up. All right. All right, so that really concludes our shopping. Ladies, gentlemen, in your shopping, please ensure you have your mosquito repellents and your mosquito mesh. All right? Remember, we are protecting mother and baby. So persons would say that they have the mesh over their bed. Remember, the baby's crib or the baby's playpen must have a mesh also. All right, I hope this was very useful for you. Please reach out to me, all right, with your comments and your recommendations as per usual. It was nice talking to you today, all right? And as I always say, congratulations on your bundle of joy. And I will see you soon, right here at Midwife par excellence. I thank you.